My name's Heather Nelson. I'm the Chief Exec of Black Health Initiative and also a member of the NHS Race and Health Observatory. Black Health Initiative is a community engagement organisation, and we're here working to address the inequalities and inequities that we find in education, health and social care. We focus very much on, predominantly but not exclusively, the black communities that we have here in Leeds. And we recently set up our mental ill health service. And it's very much about the black community because of the cultural taboos and issues that mental health has attached to it within those communities, for all sorts of different reasons, be it faith or family connections, you know. So what we had to do was actually start in a non-traditional, as in non-European way of actually addressing those issues. So our outreach is targeted and it's effective communication as well. So we will speak to people not necessarily just about mental health initially, but about their health. You know, how are they handling with the stresses, especially during the pandemic and with the visible murder of George Floyd. You know, we are traumatized repeatedly when we are seeing the negativity that's happening towards us. When you look at the stats that show the stop and search incidents, but not only the statistics, it's lived experience, because we work amongst these people. We understand, I am one of those people. So of course, it resonates more to us. So what we did was sought funding so that we could have counsellors that look like us, but actually have our culture, so that those who are accessing our services don't need to explain mannerisms or terminology because it's already known. And sometimes that in itself is a barrier to accessing mainstream counselling. Now, I've been working very closely with a few of the leaders in the various sectors about service provision. We're always talking about one size doesn't fit all, but unfortunately we're still using that one size. And to get rid of that one size, we cannot have the same people around the table all the time, because it's going to be a same thought pattern throughout. If you want effective change, then you need to go out and listen to people, be involved with those people, and actually have those with lived experience or those who are working within those communities sit around that table as well. How often do we find that those leaders understand us as people? And let's be very specific about black people. There's never usually translation for black people. Yeah? However, as much as English may be our main language, I'm of Jamaican heritage, sometimes to express myself, I go back to where my foreparents and parents come from to explain that. But I know that doesn't necessarily work. I can give you a good example of that. A couple of years ago, we had one of our elders come to us and she says she thinks she's got sugar. So I said, okay, you need to go to the doctor. She went to her GP, said the same thing. He literally rang me while she was on consultation and said, why is this woman here when she's wanting sugar? And I'm like, no, what she's telling you, she thinks she's diabetic.